Hi, welcome. What we're going to do today is go through a couple of tips for you in terms of sleeping, particularly with low back pain. Most back problems that we see tend to be aggravated at night, mostly because you're still. So if you do wake up at night with bad back, it might be worthwhile getting up and doing some movement and walking around a little bit to get the muscles moving, to calm down so that you can go back to sleep. But what we want to look at is a couple of things that might help you sleep for longer periods of time while your back is in that acute pain phase. So I've got Sergio here to help with a couple of things. We're going to look at a couple of different positions. So to start with, generally sleeping on your back with a bad back can get uncomfortable because the hip flexors are tight, the legs are straight, and this tends to pull you into extension in your back, which means that you've got an arch in there, and that compresses discs, facet joints, and all those ligaments around that area can be pushed into a position where they're tight, and over time pressure will build up and that will cause your pain. So what we want to do, if you really do have to sleep on your back, is try and find a way to lift your knees up. So at home you won't have one of these, but a cushion, pillow, or a towel underneath the knees will allow you to take the hips off pressure, will allow your back to flatten down into the ground, which will just take pressure off the spine and hopefully allow you to get some more sleep. So at night, lifting the knees up, if you do have to sleep on your back, will definitely help. You're going to have to play around with how much of a lift you need. Okay, so let's get Sergio here now to roll onto his side. So obviously one of the preferred positions. So you can see that just lying, and this is a relatively firm bed, so on a softer bed at home, you're going to get more exaggeration. You get the curve through the spine. This will tend to compress the top of the spine and stretch the lower part, which could cause problems either way. Sometimes the facet joints being compressed, sometimes on the muscles being stretched. So what we want to try and do is flatten that out a little bit. Now there's a couple of things that we can do to take pressure off. Just using a small hand towel tends to be a very simple way to reduce the load. So we can lift the knee and just bring it into a more neutral position. You may find you want a bigger support than that. And again, you need to find what works, but that will help just reduce that curve in the spine there. So that is one that works very nicely. Another way that you can do the same thing is to use, I would start with a smaller towel. And if we just lift up in there, and just put a little bit of a support in there. Again, it'll just straighten out. It'll allow your hips to sink into the bed, but lift your waist to keep you in a slightly more neutral position. You may find that you want to do the support under there and the support in the knee to help there as well. Sometimes you can also find having this top leg a little straighter will pull the pelvis down and take more pressure off. Again, it's reducing the load into the back that's important. If you're here for 4, 5, 6, 7, 8 hours at night, you're going to find that because you're not moving, things will start to feel stiff. So when you get up in the morning, make sure you get moving, concentrate on getting the muscles to relax so that your back will calm down. Then sleeping on your front is probably one of the most difficult positions to go into. We'll get rid of the movement here. And I would suggest, if you really do find yourself rolling onto your front as a habit, you can use a towel underneath your tummy and you can start in that position. That will flatten out your back, take some pressure off the muscles, and certainly stop that compression of the joints with your back dropping in. I prefer, if people are going to sleep on their side, to just bring the knee so you come into almost a quarter turn. Again, it just takes off that compressive force so you can turn, and then you're going to have your head turned to the same side as the leg. So we've gone through a couple of different positions, lying on your back, lying on your side, and lying on your front, and how to adapt them to help settle down pressure on your back. It's not guaranteed to get you through the night, but it will hopefully get you another hour or two of comfortable sleep before you wake up in that acute phase, and should help you as things progress from there. Okay, see you soon.